Hey, this is Dr. Shakib from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Balance and Stability Clinic. We have a hypermobile individual here with wrist issues, so this goes to show you what my assessment looks like for the bendy population interested in taping. So typically we have a movement up and down. Sometimes there's excess movement in a distraction position, meaning the hand can go away from the forearm a lot more than average. So what I'm doing is I'm placing my finger under the wrist and the thumb over, and I'm just squeezing it like I'm squeezing a bagel. So am I getting excess movement in the P2A, in the up and down position? Am I now trying to distract? I'm trying to move this bone away from the hand, and I'm trying to see if I'm getting excess movement. It's not so bad, but there is a little extra movement right there. So there is a little extra movement on the inside, on the thumb side, and a little bit of extra movement longitudinally. So what I'm trying to do is to basically do the cueing. The taping is not to stabilize the area or immobilize the area. It's more for sensory cueing for the brain. So when I do this, it probably feels a little bit better, and if I just bring it a little bit closer, it likes it. So I keep what I just did and found out about this right wrist in this case, and left wrist can be actually different, and that's okay. So I want to stabilize the wrist in every movement. This specifically in this situation, one of the complaints is the overbending. Is that what you said? So how do you sleep with your wrist in that position? So a little extra bending. So we're trying to maybe a little more than a little. So I'm just rounding the edges of this. What I like is rock tape. What I get is rock tape sensitive for sensitive skin, and it just seems to not have any, people don't seem to have any reaction to the tape itself, which is an issue with hypermobility individuals. The sensitivity of the skin is a little bit more. So I'm cutting the tape right wherever, just to get the opening going. I'm removing that tape, and I'm going to position the wrist in the place of leveling. So I'm trying to bring the forearm and the hand a little bit closer. Do you feel the pressure that I'm applying? And I want this bone goes a little bit from the thumb, goes all the way to the elbow, so I do want to follow that direction. I'm keeping it and crossing over the joint. Then I'm going to keep the hand again leveled. We don't want the wrist or the hand to be bent, so I have it nice and leveled. With rock tape, you do not need to pull or overstretch the tape itself, so I'm using that. And then because there was a little extra movement over the thumb side here, in your case, and this varies from person to person. I have other patients that I don't follow this format, but I'm going to wrap the tape around the wrist, so I'm going to keep it leveled, and this time it's going from, it was too open on the thumb side, so I want to close it on the thumb side, so I'm going to go from the opposite side, going in the direction I want to close. Does that make sense? So let me just get that tape, the back of this tape. I don't know why it's not going, probably because I'm recording. So bear with me while I get the darn paper off. And here we go, level it. Again, I'm not gonna overstretch it, but I'm going to reinforce that area on the thumb a little bit. So it gives a little bit of security in that area. Because there is something happening here, I'm going to flip over, and this time I'm going to go from the thumb over to that area. So I'm going to go from the thumb, level the hand with the forearm, go across. I like rock tape because it lasts longer too. You can take a shower with this. This can get wet. It has lasted over a week for some people. When I've taped my shoulder, after a few days, I was done with it. I was like, I need to get this thing off. So again, I'm placing my hand and my thumb to have an understanding of what level is, and I'm going to go up in this area, across the joint, and straight up. I've done this enough to be a little bit better at taking that paper off. And it's heat activated, so you just rub it a little bit, make sure the edges are covered. So we're going to do the same thing, not the same thing. We're going to tape the other wrist. I'm not so sure if it's going to be the same pattern. We're going to have to substantiate what's needed. But that's essentially it. Taping is not to immobilize. Taping is to give the brain sensory input as to where we want or how it should be moving. Best is to follow the anatomy in the direction that the bones or muscles are activated. If you have not subscribed to the channel, you may want to do that now, and make sure you share it with people that you think can benefit from. Thanks for watching.